Also, please hold all questions until the end of the session. And now I would like to introduce Molly Iden.
Okay, I actually don't mind if people interrupt me and ask questions. So even though I will try to go quickly through the session, and I hope that we have some time for Q&A, but I also don't mind. Okay, I'll try again. I'm going to try to move quickly. If I'm going too quickly, slow me down, but mostly I want to have time for Q&A and interaction amongst us all if possible. And first, I'd like a show of hands. Who has narcolepsy? Okay, ooh, lots of hands. And how many people in the room are caregivers or loved ones of people with narcolepsy? Okay, because some of my talk's more for you than for the people with narcolepsy sometimes. Okay, so I work at the Stanford Center for Narcolepsy. I have narcolepsy myself. I developed narcolepsy at 22, which was 100 years ago. I don't even know how many years ago now. And I've worked at Stanford sort of accidentally for the last 14 years. And I have the good fortune of having met a lot of patients with narcolepsy, and Chelsea, who introduced me, was somebody that I met many years ago as a younger child with narcolepsy. So it's been fun for me over the years to watch these young children grow up to be lovely young adults. Okay, what is narcolepsy and what it isn't? People with narcolepsy will live a long, full life. Lifespan's not affected. I think that's important to know. It doesn't make us sick. We're not more sickly. We have narcolepsy, but in and of itself, it doesn't cause other health problems or affect the length of our life. It's not a degenerative disease. There's going to be a brain donation session where I can actually show some of the slides that Dr. Mignot showed today in his talk, and I have some more information about that in the brain and how it affects the brain and what areas of the brain it doesn't affect. Once narcolepsy is stable and managed, it typically shouldn't get worse. So if your narcolepsy gets worse at some point in your life, it is important to kind of check back around and make sure that you're not missing something else. So there was actually a story that I told last year of a woman who had developed cancer but presumed all of her symptoms were narcolepsy related and didn't seek care, and by the time she actually was diagnosed with narcolepsy, it was kind of late into the process, and it was she wasn't able to take advantage of therapies that might have helped her because she had waited so long and had presumed that her fatigue and sleepiness and other symptoms were narcolepsy related and not due to something else. Changes in circumstances in our life may make the narcolepsy be more difficult to manage. You get a new job, you have a baby, you move on and through school into higher education, and the demands upon you become worse, and that will highlight the things that are more difficult in narcolepsy. But in and of itself, your narcolepsy shouldn't get worse as we get older. So some of these things that I'm showing here are just supporting research that documents some of the things that I'm talking about. But I'm not going to go over them slowly. But if anybody wants the slides, they can have this and go seek out the entire article. Okay, one thing that's important is when we have narcolepsy that we can have other disorders. Having narcolepsy doesn't immune us from having other things go wrong. Sleep apnea is quite common in the general population, and study after study after study shows that it's actually more common in people with narcolepsy every single time. So it's important to treat sleep apnea. I meet many patients who say, yes, I have sleep apnea, but I've also got narcolepsy, and that's so much worse, I don't bother to treat the sleep apnea. Sleep apnea left untreated is harmful to your health, increases your risk for cardiovascular disease, stroke, and dementia, all of these things which we don't want as we get older. And so we have to treat the sleep apnea. Even people who feel like when they've tried CPAP and don't feel that it helps them to feel better, it does work. So it's important to treat the sleep apnea, even if you have narcolepsy. And sleep apnea itself commonly does run in families. The newer medication, Xyrem in particular, makes compliance with CPAP with narcolepsy much easier. Because of the many nighttime awakenings, CPAP can be frustrating for people because they wake up so many times they find it aggravating and uncomfortable. The Xyrem helps us get that better, deep, full rest, and it allows a person to keep their CPAP machine on at night. What we also find is if somebody has been doing well, reasonably well for 10, 20, 30 years with narcolepsy and they suddenly do get worse, one of the things that we do is it may be time to have another sleep study, not to diagnose narcolepsy, but to make sure that you haven't developed sleep apnea. So, and I'm at that age where they retest you to see if you're developing sleep apnea. In women, there's some protection, hormonal protection, that prevents us from having sleep apnea as commonly as men do until the time of menopause. And around menopause, the incidence of sleep apnea shoots way up for women, and so it's important to kind of get retested later in life. So if you haven't had a sleep study for 10, 15, 20 years, it might be time to assess that. Those are different studies. Restless leg syndrome and leg pain. Who has restless leg syndrome? So restless leg syndrome is something that you experience during waking time, where you have this sensation in your legs where you feel like you need to move. Periodic limb movements are the movements in our sleep where we jerk and we're unaware of them. They bother the people who are sleeping with us and the people who are watching us sleep far more than they bother us. There's actually no real evidence that these periodic limb movements that are terribly common in people with narcolepsy, that they actually interfere with our sleep any more than not. But some doctors will treat for the periodic limb movements, but those compounds oftentimes cause a lot of residual sleepiness. So they really aren't the right medications to give to people with narcolepsy, because they cause this hangover effect that will cause you to be sleepy. So the periodic limb movements don't necessarily, most often don't need to be treated in people with narcolepsy. So this restless leg syndrome, or leg pain, which we see in a lot of the smaller children, they complain about their legs hurting, and I think sometimes pediatricians and parents say, oh, that's growing pains. But what we find when we're testing ferritin levels in children in particular, and we actually check it in people of all ages, that if your ferritin is low, you'll have more of that leg pain or restlessness or that need to kind of wiggle and move. I'm one of those people that I don't really have the leg pain per se, but I get sort of a bit uncomfortable, and my ferritin tends to be low, so I add more iron to my diet, and it fixes that right up. So ask your doctor at your annual checkup to check your ferritin, which is different than checking for anemia. And if your ferritin level is below 40 or 50, an iron supplement can be almost miraculous and help make that restless leg syndrome or leg pain go away. And even if you don't have that leg pain or restlessness, it might be worth getting that ferritin level checked. Okay. So other commonly observed traits. So this is in recent literature. They talk about depression and mood disorders in people with narcolepsy. But there's been some debate. Is that depression, or is it that the answers to the question on a depression scale are answered differently by people with narcolepsy? I think there's a bit of that you would answer things differently because of dealing with your sleepiness, of managing your cataplexy. And that doesn't necessarily mean you are depressed, but that the answers are different, possibly, for people with narcolepsy because of managing our narcolepsy symptoms. Nocturnal eating disorder. There are a lot of people who get up in the middle of the night and eat. Nocturnal smoking, that was a new one to me, but hopefully nobody's doing that. Pain, that's an interesting one, because I would say in all the years that I've worked at Stanford and all the patients that we see, I just don't hear a lot of people complaining about a lot of pain. But maybe it's something that the doctors aren't asking enough about. But there is a research article that shows that hypocretin deficient narcoleptics perhaps have more pain. Good to know. And obsessive compulsive disorder, perfectionism, I think we see this in a lot of patients. I know I'm a little OCD about things. I think that sometimes it's in our lives as people with narcolepsy that we're trying to control what we can control, because we can't really control our sleepiness as well as we would like. So if we feel we can manage and control other aspects of our life, that seems helpful. Grumpy, disagreeable, short-tempered. How many are grumpy, disagreeable, and short-tempered? Okay. So my inner 2-year-old, which shows up 2 or 3 times a day when I get too tired, has this problem. And hopefully through some of the things that we can talk about here, that we can learn to better manage these symptoms that causes us to be grumpy, disagreeable, and short-tempered. And one of the areas of research that I'm finding most interesting to read about, because nobody's doing research in this area for people with narcolepsy, there just isn't the funding to do it, but I read the sleep deprivation research. And in sleep deprivation, there's whole groups of people interested in studying sleep deprivation, so they make people stay up for hours at a time and not sleep for several days. And then when you read what the effects of sleep deprivation are, it's everything that goes on with me when I'm tired. So it's this emotional, our emotions are too at the surface. We react in a dramatic way to emotions because we're more tired. We'll talk more about that. Headaches. Is that an actual side effect, or is that an actual occurrence in people with narcolepsy, or is it more commonly a side effect of treatment? I think the jury's out on that, and it's different for different people. And headaches are common in the general population. Okay, so these are some of the articles that talk about that. This article in particular talks about, is it really that they don't find an increase in major depressive disorder in people with narcolepsy, but probably an increase in anxiety. That could be a bit of medication effect. And it also could be, again, like I'd said before, dealing with the symptoms of narcolepsy may cause us to act or react differently or answer a question on a depression scale differently that may make us look like we're more depressed without having true depression. And sorry, my voice is kind of in and out. Okay, so here are some of those research articles. Okay, healthy habits. How do we improve upon these things? So sleep hygiene. And this is, the lecture from your mother. But it does work. We find that sleep hygiene, going to bed at the same time, waking up at the same time each day, sleeping in your bed, not watching TV in the bedroom, all of those things that we all know are good sleep hygiene really do cumulatively work to help us perform better. I think I too commonly find that people with narcolepsy will say, well, I have narcolepsy and I feel more awake at 3 in the morning, so I don't go to bed till 4 a.m. But our bodies really do perform better if we go to bed at like a normal bedtime and wake at a normal wake time and in sync with our circadian rhythm. We find that people who have shift work sleep disorders, so people who actually work like the overnight shift, can have many of the symptoms of narcolepsy and even test positive for narcolepsy yet not have narcolepsy. So just sleeping against our circadian rhythm alone can cause a person to test positive and look like they have narcolepsy. So it really is important to try to sleep at follow those good rules of sleep hygiene. So again, going to bed at the same time each night, waking at the same time each morning. Exposure to some bright light in the morning is helpful. We had a patient once who came to see us from Ohio, and it must have been the winter time, and Dr. Mignot had recommended that she sit outside and maybe have her breakfast outside each morning. And she sent us this picture of her in a parka on a porch, and it was black and dark outside, and she was freezing. So we have to kind of alter that. So if you're in Ohio and it's winter, you're probably not going to be able to have your breakfast out on the deck and get that bright sunlight like we can get in California. But the light box is the alternative. So avoiding stimulants, caffeine, exercise, and too much light before bed in the evening. I know I've met people at these conferences who actually have these glasses that filter out the different spectrums of light that are more disruptive to sleep, and they swear by them. So I've never tried that. But there are different glasses so you can work on your computer and do the things that you want to do into the evening, but if you wear these glasses, they kind of reduce that light that can interfere with your circadian rhythm. And regular daily exercise. I spent decades not exercising. So I didn't exercise a day in my 20s. I didn't exercise a day in my 30s. And I even had well-meaning family members who'd say, Molly, maybe if you exercise, you'll feel better. So this one day in particular, I rushed home from work, picked up my daughter at daycare, rushed to my mom's house, dropped her off, drove to the gym, turned the ignition off, and fell asleep. Half hour, 40 minutes later, I woke up and I looked, and it was summer and the doors were open to this gym, and I could see they were cooling down, and I thought, not even going to go in. I drove back home, And my mom and my sisters all greet me with, "Oh, see, you look so much better." And I was so pissed and mad at all of them, I never told them, but yes. I realized that when you're not doing well, exercising is really kind of the last thing you want to add to your plate. So now, in my mid-50s, I can tell you that I've been exercising for a good 10 years now, and I love it, and I resent it when my work schedule causes me to miss it. Now, for me, everybody has to find what time works for them. I can only effectively exercise if I do it first thing in the morning before I go to work. That's what works for me. I know people who can only exercise in the evening. But I do think if you can find your rhythm and find that time to exercise, that it really can help us to feel better, have more energy, and feel less sleepy. Okay. Uh-huh. Well, alcohol in general suppresses REM sleep. And I mean, I think that we know that it disrupts sleep, and it's not a good idea. I think a glass of something here and there is probably not terrible, but drinking to go to sleep is not a good thing. You might sleep off the alcohol and then wake up and have that disrupted nighttime sleep. It does suppress REM sleep. I find drinking a little bit of alcohol actually wakes me up a bit. So foods with the high glycemic index are linked with good nighttime sleep. And this I try a little bit, but I'm not as diligent about it as I could be. But rice is found to enhance sleep because it has a high glycemic index, where pasta and noodles don't. So I'm always looking for ways to extend my nighttime sleep. So even though I take Xyrem and it helps me sleep at night, I don't sleep terribly long. So things that make me more sleepy, I avoid during the day and try to eat them later in the evening, always with this plan to try to enhance sleeping at the time of day that I'm supposed to be sleeping. I also stay a little bit hungry during the day to kind of help me stay awake. And sometimes that helps me eating multiple small meals a day rather than eating, the 3 major meals helps me stay awake. So the most important good habit are naps. Does everyone here take naps? Does anybody try not to take a nap all day long? So I don't understand not taking a nap all day long. I can't do that. I can make it through the workday without a nap. I do better during the workday if I take a nap. But to make it from waking up to bedtime without a nap, I'm not sure I've ever been able to do that. We do find that the planned, regular, scheduled naps work best. 1 or 2 daily is typically, best for most people. And that's my phrase, take the nap before the nap takes you. If I don't take a nap, I'm going to be doing something and nodding off, and I'm going to be less accurate, less competent, and it's going to be accidental nap rather than a planned nap. So nap when you can, plan for it, add it to your schedule. And when I wake from a nap, the world's lighter, brighter, easier, and my mood, that grumpiness that comes with being too tired, is lifted and goes away. So ideally, nap before we get grumpy. Mm-hmm.
How long would you recommend a nap? I've heard a lot of different research about 2-hour cycles.
Yeah, so I think an hour would be the longest truly recommended nap, and I think a 30-minute nap is a great length of a nap. If you sleep too long, you kind of cross over into that sleep inertia, and it's harder to wake up from. So drink water. So research shows that the rats and mice that are missing hypocretin don't think to drink water. And drinking water is a very, very basic animal instinct. And so when I learned that from some of the animal research that they had done, it dawned on me that, gosh, I can go, and it's 3 o'clock in the afternoon, and I haven't visited the ladies' room once all day long at work, which means I'm not drinking liquids and I'm forgetting to hydrate myself. So perhaps missing hypocretin, we aren't getting those cues and signals that are telling us to drink water that we need, although I am having it right now. So dehydration causes fatigue in everyone. So what I'm always working on is finding things to make me less tired that make everyone tired. So anything that makes anyone tired makes a person with narcolepsy tired times 10. So if we can improve upon all these little things that may contribute to fatigue and sleepiness, then it can help our overall day-to-day functioning. So drink water. Okay, and mild dehydration causes anger, fatigue, and mood swings. So those, again, back to that, trying to combat that grumpiness. Take care of your teeth. Most of the medications that we take cause dry mouth, and dry mouth is bad for your teeth, increases plaque and decay, causes bad breath. I'll tell you a story there. We had a beautiful young woman, smart as could be, and she called me and said, she goes, you know, I was talking with my mom and I was kind of complaining that every time I meet a new guy and I go out on a couple of dates, that after about date 3, I don't hear from him again. And her mother and sister very nonchalantly said, well, maybe it's because you have such horrible breath. And it was like, so one, she was a bit mortified that they hadn't told her this, and this was so matter of fact to them. And based upon that conversation, she kind of came to us and decided to lower her stimulant dose because she was taking a fairly high stimulant dose. She now takes a lower stimulant dose, and it's actually, and implemented taking a nap, and it has helped, and I hope her dating life has improved. I don't know. Small meals more often. Large meals or lots of carbohydrates cause sleepiness. We all know that. Lean protein. There's one research study that showed that a high protein, low carbohydrate diet that was actually done in people with narcolepsy. It's the only study that I know of that's been done, that they found that patients who had the low carbohydrate, high protein diet had not only less sleepiness but less cataplexy. Oh, and then the other thing with food and eating. So I think very commonly when we think we're starving, we really need a nap. So I think it's natural to kind of, when we're really, really tired, to say, I'm going to grab that box of crackers, I'm going to have 10 cookies, because I always have 10. I know I'm not one of those persons who can have 1 or 2. But I learned as I would gain weight over the years that instead of being starving, because I was having meals, I was eating plenty during the day, that I learned that when I think I'm starving, go take a nap, take the nap, and wake up from the nap. If I'm still hungry, then I eat whatever I want. But before I grab something to eat to help me stay awake, it really might just be I'm tired and you can't fall asleep while you're physically eating something. And invariably I would end up taking a nap anyhow, but now I've got an extra 1,500 calories on top of it all. So I learned to take the nap first, and then if I'm still hungry when I wake up from the nap, then I go ahead and eat whatever you want to eat. The rat in my study show that the hypocretin deficient animals actually eat less and are heavier. So there may be a true metabolism effect from missing hypocretin. When I learned this, I took that knowledge and said, okay, I have to be better. I suspected it before this research came out. I'm one of 5 girls. I've got a bunch of sisters, and you know, sisters are kind of competitive with each other. And I felt like I ate less than all of my sisters, yet was the heaviest of all of us. And when I saw this research that said that the rats and mice without hypocretin are heavier and eat less, that just told me that I need to be even more diligent and more regimented about my diet. With too much weight gain, many people with narcolepsy do develop other comorbidities, things like sleep apnea and type 2 diabetes. So type 2 diabetes has been found to be more common in people with narcolepsy than the general population statistics. So it is something that we need to watch for. And then that's the article there that was done 2004, so it's been a while. Somebody else needs to do another diet research study in people with narcolepsy. Okay. Also, the sleep fragmentation, so the multiple awakenings also just changes hormone levels. So we know that with sleep disruption, so not getting enough sleep of the right kind of sleep. So whether it's sleep apnea or narcolepsy, that we see leptin levels go down and ghrelin levels go up. And leptin's the chemical that tells us we're full, and ghrelin's the chemical that tells us we're hungry. So because our sleep is disrupted, we've also probably had these hormonal differences that kind of are working against our, sticking to our diet. There's also been some findings that the fat tissue is actually different in people with narcolepsy. I haven't seen any articles in the last couple of years, and I don't know if they're continuing to do research work in this area, but it's interesting. Medications. So before I talk about medications, first I want to talk a little bit about doctors. So I think that doctors, are there any doctors in the house? Okay. So I think that doctors have, if it ain't broke, don't fix it. So if we don't complain or ask for if there's something different, that when they see you, they're going to, kind of endorse what you're doing and send you on your way and not make a change to your medications. I, as a patient, used to think, well, surely if there's a new medication or something different I should be doing, my doctor will bring it up to me. I also used to go to the doctor and think, well, I just saw him 6 months ago or 3 months ago, however long it was. And when he asked me how I was doing, I was having cataplexy 4 or 5 times a day. I was falling asleep at every stoplight. And so when he asks me how I'm doing 3 months later, I said, I'm doing about the same. And I think that maybe I needed to reiterate those things and tell him again. So we need to be good at informing our doctors how we're doing and what's not working well, and ask questions about new medications. Because if we don't complain, and I used to think, well, he knows I have narcolepsy. Surely he would tell me if there was something better I could be doing. So I think that we need to proactively go to the doctor with that list of this is how my symptoms are affecting my life, and not presume that he remembers what you told him before. Okay, what tends to work best? Everyone's different, so not one strategy will work well for everyone. We need to be, I do think we need to be open to trying something new. There are people who I meet who just don't want to try a new medication. They're comfortable with where they're at. They're better on the medications that they've been taking for a long time than they are when they're not on medications, but they're really resistant to trying something new. And I guess I would encourage everybody to be open to trying something new, because there's nothing that will stop you from going back to what you're doing today. Trying a new medication is not a lifetime commitment. We can always go back to what you're doing now that's working, but maybe be open to trying something if your doctor makes a suggestion for trying something new. Dr. Mignot really feels quite strongly that we only want to make one change at a time. If you're changing 2 or 3 medications, we don't know what's working, what's not working, what's causing the side effects. And then there's a 10-day rule. There's many times people will take medication for 1 day, or stop a medication for 1 day or 2 days and say, this isn't working, this is not okay. You really have to give it about 10 days before you can assess, am I better, worse, or the same? And that's the question that I always come back to, because sometimes when somebody's tried a new medication, they become hypervigilant as to, well, this isn't right, and that's not right, and this is going on. So the question I circle back around to, okay, so I hear this complaint, but compared to the old medication, are you better, worse, or the same? Because sometimes it may be that the doctor misinterprets your complaints about the side effects and how you're feeling as that you're worse when maybe you're better. Does that make sense? Okay. And if my personal feeling that is if the cataplexy is well controlled, that the sleepiness is easier to manage. I meet lots of people who choose not to treat cataplexy. I have a harder time understanding that, because for me, trying to manage cataplexy, trying to strategize how to avoid having cataplexy was so exhausting that it made my sleepiness, unbearable. Once my cataplexy was really well managed, now I just am having to manage my sleepiness. I'm not having to constantly strategize, who's the person in the room who I should tell that if I fall that I'm okay and not to call an ambulance. So I do really think that getting the cataplexy well managed is an important part of treatment. And many doctors out there start with the stimulants first, for some reason and sort of later then start treating the cataplexy. But I do think treating cataplexy is important. So Dr. Mignot feels that if you're using the stimulants, particularly the older stimulants, that the longer acting formulations are better than the immediate release formulations. Why? So the immediate release formulations sort of cause this spike up, but then you kind of crash from it. And then you want more and you crash from it. So I know back in the days when I was taking the older stimulants, and those were the only medications that were available. So when I was in my 20s, I felt like an 80-year-old at the end of the day because I'd had these spikes as I'd go through. And now I will say, as somebody who is older now, that I feel much more my age appropriate in terms of my sleepiness at the end of the day. Yes, I'm still exhausted. Yes, I still fall on my couch when I first get home from work, but I don't feel like an 80-year-old. I feel like a 54-year-old. Sometimes less is more. So sometimes people think when they're not doing well that they need more stimulant. They need more stimulant. We see this particularly in kids. More stimulant can sometimes just make you more angry, grumpy, and difficult. Some of those symptoms that we all raised our hand that we experience. So the answer isn't always more stimulant. It may be the timing of when you take that stimulant. Earlier, later, divided up into 2 doses rather than taking it all first thing in the morning. There's no one set path that works for everyone, but be open to kind of trying timing doses differently, maybe a better answer than more medication. And then naps are often really the best medicine. It really is the best way to kind of keep our mood intact, to keep vigilant and clear. The stimulants are a wonderful tool for helping us to stay awake and surviving, but I'm not sure for everyone that it causes clarity and accuracy, and some people get on edge. I'm one of those people, get more on edge when I take a stimulant. So lifestyle strategies. Is this helpful? Okay. Okay. I feel like I'm fumbling. So planning backwards. I do this all the time, and maybe it's a little crazy, I don't know. But so I think that in order to set ourselves up for success, so sometimes, patients will show up for their appointment like 40 minutes late, and they'll say, well, I have narcolepsy, I can't be expected to be on time. And I'm like, it's not true. You have to be able to be on time and perform and meet our obligations. So set ourselves up by success by planning in time to be able to take that nap. Or to, if something's going to take you longer, add that extra time. And that's what I mean by planning backwards. Take care of your needs so that you will get more done and get it done effectively. But plan for that, need for a nap so that we can show up on time and perform. And then pushing through that sleepiness rarely works. I mean, I know we all do it. I do it as well. But it really isn't the most effective way to live all the time if you're constantly pushing to make it through the next 10 minutes of your life. When I hit my rock bottom and was at my worst when my narcolepsy wasn't well managed, I felt like 100% of my energy was used constantly to make it through the next 10 minutes of my life, which isn't very effective in living a productive, full life. Be a good student of yourself. You can't expect something to change or improve if you don't do something different. So if something's not working for you now, try to change. Try to hear some of these things. Try taking a nap for those of you who don't take a nap and see if it helps. And maybe a nap's not, a couple people raised their hand that they never take a nap. There are people, I'm sure, who do better with not taking a nap. But if you're not doing as well as you'd like to be doing, please be open to at least trying something different, and then maybe give it that 10 days before you give up on it if it doesn't work the first day. And this is for family and friends. No one, and I mean no one with narcolepsy, likes to be told to take a nap. So I react inside like a 2-year-old when somebody tells me to take a nap. And one thing I've been thinking about recently, because I'm that person who gets angry when I get tired. And you can't be spitting mad and falling asleep at the same time. So even being angry and grumpy and argumentative is a coping mechanism for dealing with our sleepiness. It's just not the most effective coping mechanism because we kind of lose friends and make enemies. But loved ones, find a code word. Don't tell your loved one to take a nap. For some reason, it feels demeaning. So find a different way to express yourself. Make a deal of what that discussion is going to look like when you're really well rested and feel good. And then, you know, my daughter and I had a pact where if I was being that mom, the rat mom, you know, I'd come home and the dishes in the sink were rat. And it was things that I really didn't care about, but I was like bothered by everything because I was tired. And she could say to me, Mom, you might want to spend some time in your room, was code for Mom, you really need a nap. But I didn't want to hear that from my teenage daughter. So Mom, you might spend some time in your room was like, light bulb would go off in my head and I would say, I do. I need to go to my room. I would go take a nap. I'd come back. And nothing bothered me when I would come out of that nap. It really did work to kind of help reset my mood, and I wasn't the rat mom anymore. So this preemptively nap before we become that person, that's a tough one. I keep trying to work on that. Like, you know, I know that I get grumpy in the afternoon. I know when I'm feeling tired, but sometimes, I mean, I still feel I'm horrible at recognizing when I need a nap to always effectively preemptively nap. And I think it's, I think about it a lot because I'm fine, and I'm absolutely not fine. So it seems to catch me by surprise, and I'm thinking about this stuff all the time. I'm talking to patients. So none of us are perfect, but if we can find that if this person that we become when we're grumpy always happens at 3 or 4 o'clock, well, we know from the MSLT napping test that we can fall asleep at 9, 11, 1, 3, and 5. So if I'm grumpy every day at 4 o'clock, I probably should take a nap at 2 o'clock, even if I'm feeling fine and not grumpy at that time. If I actually allow myself to lie down, I will fall asleep. And most of us will if we let ourselves. So we have to learn to give ourselves permission to take the naps that we need to take to be our best self. And that's really hard because it feels, I still feel a sense of shame when I fall asleep. And I work in a sleep center. I'm the only one who works there who has narcolepsy. I'm sometimes not the only one falling asleep in a lecture, but I am the only one who has narcolepsy who's falling asleep. And I still feel when this happens, I'm instantly ashamed, and I kind of get this rock in the pit of my stomach that feels like I failed yet again. Because up until that point, I've been wiggling, doodling, crossing and uncrossing my legs, doing everything to try to stay awake, struggling. I have a good friend of mine who used to sit next to me in all the lectures, and he would turn to me every once in a while and say, I am just exhausted sitting next to you, feeling you work so hard to stay awake. And he was a good friend of mine, and I appreciated when he said that because I'm pretty sure the rest of the people in the room didn't notice, but as my close friend, he would see me just struggle to stay awake. But anyhow, let's see what we've got here. So sleep deprivation. I really do think that if anybody's interested in looking up research and reading about the effects of sleep deprivation, that you'll find very familiar phrases about the way us people with narcolepsy feel. So there are people doing research in this area. The problem is with us with narcolepsy is that we can have these bouts of feeling completely sleep deprived in intervals that maybe occur 5 or 6 times in a day. And it's not all day long that we have these same side effects of sleep deprivation. So it's not that we're sleep deprived, and it's not that we're doing it to ourselves, but it is, I think the lack of hypocretin causes us to have these symptoms as if we've just not slept for the last 48 hours, very suddenly at 2 o'clock in the afternoon. These are my questions. This is what I'm reading into the sleep deprivation research. So maladaptive emotional regulation. That's that quick to react, the being too sensitive when somebody says something that you perceive as negative. And I think when I'm tired, I hear things more negatively. I feel a bit picked on. When I'm talking to parents of kids who have narcolepsy, when I try to describe to them, I said the grumpiness of narcolepsy is an absolute impatience with the world where you really just want everybody to shut up and do it your way because you have no tolerance for anything else. And that doesn't make for a very nice person. So in kids, I think, because they're comfortable with their parents and lashing out at their parents, parents get the worst of it, or your loved ones or your spouse. But that's that grumpiness that we can all work on trying to preemptively counter. But I understand it. So our memory formation is impaired judgment, inattention, slow reaction time. So in and of itself, having narcolepsy doesn't translate into a lack of memory. Sometimes I hear people say that, oh, well, I have narcolepsy, I can't possibly remember anything. And you can't remember things if you aren't awake enough to take in information. But the memory of a person with narcolepsy isn't affected. We don't have a deficit in memory. But if you're too tired to learn, if you're too tired to take it in, then you won't remember what you actually didn't learn. If you do have true problems with memory and you are taking your naps and taking care of yourself, it might also go back to circle around to the beginning of the talk just to make sure that you don't have sleep apnea, because that's a different cause of sleepiness and a different lack of oxygen to the brain, and that can cause memory impairment. So again, another reason to treat the sleep apnea or circle back around and check to make sure you haven't developed sleep apnea. And Stanford biologists explore a link between memory deficit and misfiring circadian clock. Again, back to that little lecturing comment in the beginning that if you're staying up till 3 in the morning because you have narcolepsy and I understand that night owl, who has that kind of night owl waking up at the time that you're supposed to be going to bed? So it's very common for all of us. I think Xyrem goes a long way to kind of helping regulate us and normalize our sleep so that we go to sleep at bedtime and wake in the morning time. But if we're sleeping against our circadian rhythm, it really can impact so many aspects of our body. So memory, even our digestion. It's amazing the things that our circadian clock controls with our bodies. So our bodies will perform better for us if we go to bed at a normal bedtime and wake in the morning. Give yourself permission to take care of your needs. This is a tough one. I see it all the time. We see a lot of kids at Stanford, and there are many children who don't want to take a nap, refuse to take a nap. I, as an adult, had permission to take a nap at a job that I had. My bosses all knew I had narcolepsy. There was a private office that nobody used. I just felt, I think it was that sense of shame. I didn't want anybody to judge me or think I wasn't pulling my own weight, that I shot myself in the foot and didn't take the naps when I needed to. And I think we need to learn for our own sake. It really is for our success that we have to give ourselves permission to take a nap. It wasn't until later when I had left that career, I used to work in money management, when I looked backwards and saw that my lack of taking naps really had kind of caused me to not do as well as I would have done. And that looking backwards also, I saw, well, there was that one gal that I worked with who went shopping every lunch hour and took like came back late from lunch every day. And then there was that guy who called his fiance and talked on the phone for 10 or 15 minutes every day. Everybody else in the office had felt this permission to do personal errands, call about their phone bill. I never gave myself permission to take care of anything personal at work, and I wouldn't even take a lunch break. And I wasn't fair to myself. So we have to somehow find some acceptance, get rid of that shame and guilt about being less than, because I still struggle with that every day, and I know, how many people here struggle with that, feeling less than? Yeah, so it's hard. Give ourselves permission to take care of our needs. So no need to explain. Let me explain what I mean. I have gone to see a psychologist off and on, different times in my life. And at one point when I wasn't working and I was just about to go back to work, and I was talking with her about that I was worried about, should I tell my potential new employer that I have narcolepsy? Should I not tell them? And I'll need a nap in the middle of the day. How will I do that? And one of the things, when you see a therapist, that they have these little nuggets that I felt like 90% of the time I just paid her to listen to me talk. But these 10% of the time when she would give me this little nugget that was very meaningful, and she said, Why do you have to explain to anybody why you need a nap in the middle of the day? Just say you need a longer lunch hour, or that you need to leave the office every day at lunch. Whatever it is that you need to do, just ask for it. And they really can't ask you for an explanation. It could be that you're taking care of a child, dropping them off at daycare. It could be that you have an elderly parent that you're needing to take care of their needs, or it could be that you have narcolepsy and need to take a nap. But we don't owe people an explanation. It's okay to ask for something without feeling like we need to explain ourselves or feeling that less than. Does that make sense? I don't know. But for me, that was like such a huge revelation. I think baby steps can lead to making big changes over time. So some of the things that I've talked about, drinking more water, going to bed at the regular time and waking at the same time, these aren't going to transform your life with narcolepsy into being somebody who doesn't have narcolepsy. But I think if we can put all these healthy habits together and incrementally improve upon how we feel, in addition to the medications that you need to be your best self, that we can do much better. And then hardwire your brain to be happy. I think everybody fails at something every day. So I tend to be, hard on myself and a bit of a perfectionist. But if we realize that everybody fails at doing something that they intended to do each and every day, we need to forgive ourselves, and it's okay that we need to take that nap. It's okay that we get tired, and it's even okay that we get grumpy occasionally. And that our brains do have this negativity bias, making that our brains react more to this negative stimuli, so it takes some practice and some skill to kind of try to find the gratitude and the great and the positive in day-to-day things. So I work on that. Taking a nap, it's my superpower. I can take a 15-minute nap and feel like $1 million. And I can actually fall asleep in less than a minute or two. And most people who don't have narcolepsy, can't fall asleep that quickly. So I have to look at it differently and embrace it to feel better about it. Because it's not fun to always be so hard on ourselves. Okay, that's it. So do people have questions, comments? Yes.
You talked a lot about circadian rhythms.
Uh-huh.
Read a little bit about before electricity, people used to have second sleeps. So falling asleep right after dinner, 8 to 11 or something, waking up from 11 to do whatever you need to do, and then sleeping again from 2 to 6 a.m. or something. Is that something that you've seen, or is that not recommended at all?
Well, I don't know that I really know the answer to that. But I'll circle back around. What works for a person, what works for me may not work for you. And if that works for you and you find you do well and are doing better, then embrace it and do that. I mean, in a way, I do that because I don't nap very often at work. I should nap every day at work, but when I take a nap at work, it's probably only 15 minutes. I go home and I'm debating, do I put food in my mouth or nap on the couch? And sometimes it's a little bit of both at the same time because I'm hungry and I'm tired. But the first thing I do when I get home is I sleep some, and then I wake up and take care of the things I need to take care of. So household chores, making myself a healthy meal, because I have to actually feel rested to make a healthy meal. When you're really, really tired, you want to eat whatever's quick. So in a way, I sort of do that, but I'm not sleeping 2 or 3 hours. I'm probably sleeping 45 minutes or so. Uh-huh. Thank you. That not to expose yourself to these different spectrums of light. So when that was in practice, that second sleep was before electricity. That time. Anybody else? No? Quiet group? Thank you.